The health officials say that the public should remain vigilant of a virus that is spreading in the southern province. The virus, which is common among children, has claimed the lives of 5 children in the past month.
The number of patients who arrive at the Karapitia Teaching Hospital in Galle with fever has rapidly increased in the past few days. The doctors say patients who are being admitted included children who are 2 and 3 years old, as well as infants who are less than 6 months old. High fever, cough and breathing difficulties have been identified as symptoms of the disease.
We have examined the matter with the other doctors in the hospital and we have identified the situation arose as a result of a virus that causes pneumonia. This is caused by the influenza and adenoviruses. This affects children who are less than 2 years old.
A 6-month-old infant died on the 10th after being admitted to the hospital. The infant was a resident of the Horagoda area in Matara Akurasa. The infant had been initially admitted to the Karapitia Hospital on the 25th of last month and had been transferred to the Lady Ridgeway Hospital in Colombo.
The child was at the Lady Ridgeway Hospital ICU for 15 to 20 days. We couldn't save her. Everywhere we went, we were told that there was no medication.
The post-mortem examination revealed that the cause of death was pneumonia. Meanwhile, an infant who was 9 months old had passed away last Saturday. The infant was a resident of the Galboka area in Valigama. The child had been initially admitted to the Matara Hospital and had been transferred to the Karapitia Teaching Hospital. Here too, the post-mortem examination revealed that the cause of death was pneumonia.
It was a virus. It is good if they at least try to save the other children. We believe that 4 to 5 people have died in the past month as a result of this disease. Several steps have been taken within the hospital. The visiting times have been reduced. We have limited children being brought to the hospital. We have initiated steps to wear face masks and gloves inside the wards. We can see there is a reduction.
The Health Services Office of the Southern Province announced that the staff at all divisions have been notified to identify the areas that have been affected by the disease. The Epidemiology Unit of the Ministry of Health has commenced a broad investigation into the deaths at the Karapitia Teaching Hospital. Director of the unit, Dr. Anil Disanaika, said officials of the Medical Health Institute as well as microbiologists of the Karapitia Hospital will be carrying out the examinations.
If there are symptoms of fever and diarrhea, do not send your child to school and make sure he or she recovers completely. It is extremely important to keep your children at home if the child is attending a daycare center or preschool with these symptoms. It is a virus. We cannot identify what it is at once. The specialist doctors have informed us steps that should be taken to prevent this. If there are symptoms, take the patients to a hospital immediately. Do not let children roam around in public places. When there is a new disease, it is difficult to diagnose it at once. When they held investigations, it was identified as a virus and not a bacteria. It is difficult to control the spread of a virus.